Patients have screened by the special questionnaires. There is a lot of questions about the type of the headache, about the intensity, or any other neurological symptoms or abnormal signs. Once it's sudden or abrupt headache, or the patient who is older after the age of 15 years, and prior headache history with the first headache, or maybe different or progressive headache type, and secondary risk factors like an HIV, cancer, or anticoagulation, or maybe the pregnancy. So usually the primary headaches involving the most often seen headache like the migraine and tension type. The both of them can be episodic. So episodic means when we have less than 15 days in months, and chronic when we have more than 15 days in months. And also one of the type of the primary headache, it's a trigeminal or it's a cluster headache, which is rare, but also I show the results from our work, and we can see it's not all rare in our country. So, totally 25 patients, and 77 of them were the secondary headache patients. It's around the 34%, and 148 patients was with the primary headache. And if you talk about the gender presentation, so the woman is 183 and 42 is men. Then we had divided the patients for the two groups, so the patients with the primary headaches and the patients with the secondary. On this diagram, you can see that in the group of the primary headache, so migraine and tension type headache was in the first and second place. Tension type headache is seen in 63 patients and migraine in 58. Also, we are seeing some very rare cases of headache, for example, primary headache associated with sexual activity, also the headache attributed to the external application of a cold stimulus, and we also have 15 patients with the cluster headache. Secondary headache, when we use the Snoop's red flags, we found that mostly patients with the secondary headache was with the medication overuse. Headache due to the tumor of the brain, 5 patients, and there is a lot of patients who had a pathology of the ENT and disorders of the eyes, and also the cervicogenic headache. If we talk about the medication overuse headache, as I said before, this headache occurs when the patient's treatment, they skip or they not to go by the prescription of the doctors. They used a lot of analgesics, more than the 10 or 15 days in a month. And 25 of the patients was used the combined analgesics. 5 of them NSAIDs and triptans for the 4 patients. Originally, headache type of these patients, 20 was with the tension type headache, 10 with migraine without aura, and 4 of the patients have the daily persistent headache. And as you see, the gender, the men, the woman is used or have the medication always headache more than the men, and 2 times. So now I will talk about the migraine because my generally and my PhD thesis is related to the migraine. So if we talk about the migraine, we have 58 patients with the migraines, and 30 of them have episodic migraine without aura, 7 of them with aura, and there is a diagnosis like in a possible episodic migraines. 12 people have a chronic migraine, and 7 people have a migraine, menstrual migraine or menstrual associated migraine. So the median frequency of attacks it's related for the migraine per month. Episodic migraine without aura is around the 4.2 days. Episodic migraine with aura is 2 days. For the chronic migraine, the frequency of attack was 15.4 days. So the median duration of attack, if you talk about the hours, episodic migraine without the aura in the most patients was lasting the 22 hours, and 7.2 hours for the chronic migraine. Medication overuse also to see which drugs usually the patients used in case of the treatment, exactly the migraine attacks. We research all the drugs, and in our population, it's usually or often used drug with the citramon. Around the 50% of the patients use them, And also about, if we talk about the NSAIDs, it's a naproxen or ibuprofen, it's around the 30%, and only 2% of the patients was used a special treatment which is called the triptans. So this is an example of the diaries. It's on the Russian language, but here is all the patients can write the about the headache, what was the headache, on which side, the intensity, is it associated with nausea or vomiting. So everything is written here, and on the last level you can see they write how many drugs they use during their attacks. So it's also another one. And if we conclusion, so characteristics of the headache is similar to the world data. So primary headache seen in 66% of the patients and secondary in 34%. So there is in our country a low awareness of the population also, and also of the doctors about the migraines, because around 85% of the diagnosis migraine was putting in the first time. And also excessive use of drugs, for example NSAIDs or the codeine containing or the combined drugs for the relief of the headache attack, can result of medication overuse headache or any complication from the other system like an ulcer or the decreasing of the blood pressure. And many patients do not serious attitude in the keeping of the diary. And this is my last slide. So no brain, no pain, and no headache, and you don't have any problem. Okay, thank you very much. If you have any question, I will be.
Thank you, ma'am. Thank you so much for giving us your precious time and being here in person and blessing us with your intellectual research. Now we would like to take questions from the audience, especially students.